There's a very old adage I remember hearing in medical school from some of the older ENT professors that the smallest thing you should put in your ear is your elbow. Hi, I'm Dr. Joe. Our ears are one of these parts of the body that we don't necessarily think that much about until there's a problem with it. But we rely on our ears obviously for hearing as one of the 5 senses, and the inner part of the ear is also connected with balance. So in this video we're going to talk about simple things just to look after your ears. The ear divides into 3 parts: the outer ear, the middle ear and the inner ear. The inner ear is like the nerve centre of the ear, and it's to do with balance, as we said, and obviously hearing as well. The middle part of the ear is like the amplification chamber, and that's the part where in children in particular they may well get infections called, not surprisingly, middle ear infections. And that will typically cause a pain in the ear. It's the sort of thing that a child may scream at 2 in the morning with an earache, and it does hurt quite a bit. If any of you are watching remember having earache as a child, it is a painful experience, and the middle ear infection will generally need an antibiotic. The outer part of the ear is known as the ear canal, and that's the part that people sometimes stick things in. Now, the ear canal produces wax. It doesn't do that just to annoy us. A little bit like mucus in the nose has a protective effect, wax in the ear also has a protective effect, and it's designed to trap dusts and other particles and help save the ear from damage. The way the ear is designed with its, if you like, outer component and the ear canal is all designed to protect the more sensitive parts of the ear from external damage. Again, in a similar way that the eyes have lids to protect it from damage. When wax builds up in the ears, it can cause blockage, and there are some simple ways of dealing with that. There are some ear drops that you can get over the counter at the chemist, and they are often quite successful. I've heard from a lot of Italian people that olive oil in the ear is helpful as well. And there are also the ear candles that have their supporters. Not everybody likes them. The ears, if they are blocked, can be syringed out by your GP or a nurse at the practice. This is a process which is relatively simple, like all medical procedures, not entirely without risk, but if done in the right hands, quite safe and does provide relief. Cotton wool buds are a problem. I think most people will have used them at some stage, but because the ear canal is a blind end tube and you're putting something in there that really pushes down the tube, you're really having to pull stuff out. The tendency is you can push it further in, so be very, very careful with cotton wool buds. In fact, really, they're something that shouldn't be used. And we think of them as being soft, but if you press on a cotton wool bud, they're not actually all that soft. It is possible to perforate the eardrum with them. Happens rarely, but be careful. Paper clips almost sends shivers down your spine, but you can really do some damage to yourself with those. Some people are prone to water staying in the ear after they've been swimming, and this particularly happens with people if they have slightly narrower canals. Now that's not an abnormality, a bit like some people have got brown eyes and blue eyes. Some people have wider canals, some people have narrower canals. Giving their head a shake, look, it sounds old, silly, even old-fashioned, but it does work. There are drops you can use to evaporate water out of the ears. For some people, use of earplugs when they're swimming can be helpful to keep the ears dry as well. Alrighty, so look after your ears. You only get one set. Yes, these days there are cochlear implants, and it's been a great innovation for people who have deafness, but really it's a good idea to look after your ears. Try not to expose yourself to excessive loud noise, because that can damage the inner part of the ear and that can be irreversible. Protect your ears by not putting things in it like paper clips that shouldn't be there. And again, if you are doing a lot of swimming or spending a lot of time in the water, consider use of earplugs if you're a little bit prone to ear infections. Look after your ears. Very basic principles. It'll mean you can continue to enjoy all the sounds of life.